Welcome to Excellence in Practice, the podcast where we highlight the people building, leading, and elevating Hernando and Citrus counties. I'm Dr. Eric Strouse, and in each episode, I sit down with outstanding professionals, business owners, and community leaders who are doing meaningful work and setting a higher standard in their fields. We go beyond surface level success to uncover the decisions, challenges, and principles that drive real excellence. If you want to learn from individuals shaping our community and discover what it really takes to perform at a high level, you're in the right place. Today I have with me Dr. Othman Rezki. Dr. Rezki is a double board certified oral and maxillofacial surgeon. He completed his residency training in oral surgery at the world-renowned Cook County Hospital in Chicago, where he gained extensive training in facial trauma reconstruction, corrective jaw surgery, TMJ procedures, and head and neck cancer. Dr. Rezki now works at the prestigious Coastal Jaw Surgery, where he offers a full scope of surgical treatment under general anesthesia with a focus on patient safety and comfort. Dr. Rezki, welcome to the show. Cool, awesome. So
Yeah.
then we'll get into it here. So I wanted to know kind of your background in oral surgery and dentistry. Tell me a little bit about if you always wanted to go into oral surgery. How did you find that path?
Yeah. So actually, I did not know I wanted to go into a surgery until maybe late into dental school. All my friends were like, you're too young, you should specialize this and that. So I was actually between ortho, and surgery.
Oh, I didn't know that.
No, yeah, I was. And then ortho at that time was pretty expensive, at least the programs I was looking at, and I shadowed a couple surgeons and I enjoyed it, and I liked the quick turnover aspect, so that's how I got into it.
That's awesome.
Yeah.
What about dentistry in general? What kind of drew you into the dental field?
Yeah, so my dad is a dentist, so I knew since I was a kid I wanted to be a dentist. He actually had an extra up room in his clinic, and he's like, when you grow up, this is going to be your spot. And so yeah, it was pretty natural. Now I'm here in Tampa. He still practices back home in Morocco.
Okay.
Uh, my sister, my younger sister, she's a dentist, so she works with him. So all good.
Awesome. So you grew up in Morocco? When did you move? Tell me a little bit about that.
So I grew up. I was born in Casablanca in Morocco, and I lived there until I was around 15 years old. Then I moved to Montreal, Canada, because of the French speaking. In Morocco, we speak French. So I got a scholarship for soccer. I went there, so I did played soccer, and at the same time I studied. I did dental school in Montreal, and then I worked a little bit there as a GP actually, and then I moved to the U.S. I went to Chicago for surgery, Cook County Trauma Center for surgery school for residency, and then I came down to Tampa.
Cool. So soccer, so you were a pretty serious player.
Well, I'd like to think so, but I'm like too old now.
Too.
So
Yeah.
I was pretty good, not good enough to become professional, but
Okay.
good enough where I could play college and stuff like that.
Where did you go to college?
Montreal, University of Montreal.
Oh, University of Montreal. Okay.
Yeah, yeah,
So it was
yeah.
like a big division. Is that part of like Division One? How does that work in Canada?
Yeah. It's the same thing. It's part of Division One, and there's a pretty big club, semi-professional club where when the school college is done, we all go play in the league, summer league, which is a semi-professional league, and this is how we did it back there. Here would be the equivalent of Division One for college athletes.
Gotcha. That's awesome. It's
Yeah.
great to have that college experience of
What about
competing in a
you?
sport. I ran
What about
track in
you?
college. I went to a small school, Division 3. It was a liberal arts school. So I ran track. I did the half mile. So got that same
Wow.
kind of student athlete experience,
Yeah.
which is pretty cool. You get to meet good people that way. Yeah,
And
it's
I feel
fun.
like it gives you also um, you're more, how can I say this? Not strict, but you're more, help me out with the word here. Uh,
Disciplined, focused.
100%, yeah.
Yeah,
Disciplined, focus, you know what you want. Your time is very limited, so you got to make it work. And I think it helps us also for our everyday life.
absolutely. You kind of learn to prioritize things and to manage your time, which is, a skill that not that many people get to learn early in life. So having that in college, I think, that's why we're able to succeed, right? Because we learned early.
Yes, yes, sir. Yes, sir. And also it teach you how to say no, when your friends want to go out, party, this and that, and you're between this, you have an early game the next day and you say no. Back then it hurts because you're like, oh, I'm gonna miss out this and that. But then fast forward, you realize that, experiences and fun, you can always have fun later.
Yeah.
But school or whatever game or whatever you had is like now you gotta it's game time, as we said. Same with surgery. When you're in surgery, the surgery is the game time. There is no room for thinking or no room for not being sure. Or when someone is bleeding in front of you, it's game time. You got to stop it. You got to take care of it. So,
Yeah, to all that preparation is comes down to that when you're in the
hmm
moment in the game. So yeah, I find that a lot of people that participate in sports and compete, do high level academics and succeed as well because it's kind of that same atmosphere professionally.
for sure. Yep. Yep.
So, coming to Tampa, what brought you? Was it the weather? What kind of brought you from Montreal down to Tampa, Florida?
Yeah. So that links up to what I like to do outside work. The beach. I'm like a big beach guy, and I grew up on the beach in Morocco, in Casablanca. So basically, Tampa was the best fit for me. Like a city where you can have a family, and at the same time, it's not like Miami craziness. At the same time, Florida here, West Coast. I feel like people were just nice in general, more older school, I would say, and that beach proximity.
Yeah, what was the process like for looking for a job for oral surgery?
Good question. So we have a website where we basically put our like CVs and then another website where there's like job offers, and you just go look, apply, and you receive phone calls. And I was lucky enough where our founder, Dr. Picos, called me and was like, "Hey, I looked at your CV. Looks like I have some good stuff over there," and ended up working out, and I came down here.
Yeah, that's great. I know Dr. Picos is pretty world renowned in regards to oral surgery. What's it like? What's it like working with him?
Yeah, I mean it's great, having someone that experience, and with the guy who teaches the surgeons, having him on 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 a text message anytime I need him, and his institute also, he has a full institute where he does courses for surgeons and dentists and other specialists. Having that proximity is just we're just top notch technology, um, and yeah, just sometimes I just look at him. He's I think 76 years old, and I'm like amazed and impressed. How how can you still be? He still works 4 days a week.
Really?
Yeah, so 4 days a week.
I did not know that. I met him a couple times at the study club that he holds down in at the office in Trinity.
Yeah,
And yeah, to see someone that he's still, completely sharp, he's still out doing his
grinding.
thing. It's amazing.
Yeah, yeah, and then we have our friends at like mid 30s, 40s complaining about working 3 days a week. And the guy, he's working 4 days a week at 76 years old with courses on weekends, flying every weekend. I'm like, I can't complain, you know what I mean? Like,
Yeah, for sure. So he goes internationally to do
yeah,
the courses.
nationally, internationally, he gives
Wow.
courses like in Greece, Brazil, Portugal. I'm trying to get him to Morocco.
That would be pretty cool. What are some of the trends now in oral surgery? What are some of like the hot topics that the surgeons are talking about, learning about?
Yeah, I would say, I think I talked about that at my previous presentation and meeting. PRF, XPRL, PRF, which is plasma-rich fibrins, basically stem cell and growth factors that helps tremendously with healing, recovery, mainly for the soft tissue. Uh, I don't see any more dry socket using PRF. I don't know what's the last time I've had dry socket. And then the Exparel, which is the liposomal bupivacaine. It's basically that long-acting shot we talked about also. Um, and then that helps a lot, especially with the narcotic pandemic or epidemic. And a lot of people we see are young adults, and I tell the parents, I don't want to be the one responsible for your kid addiction. So all I do is basically, let's say if I'm doing wisdom teeth, I give them exparal injections on the bottom two wisdom teeth and PRF. All they need is ibuprofen and Tylenol and no narcotic, zero narcotics, zero, no narcotics at all.
And they heal up really nicely from that. It seems like a lot of the trends kind of with healing, recovery, that type of thing.
Yeah, yeah. And then the other thing is, if I have to talk more ortho perspective, orthognathic surgery is a lot of the custom stuff, custom plates,
Mm.
surgical guides, custom screws. So a lot of computer planning, doing the surgery in the computer before going into the operating room. So um, uh, double jaw surgery or triple jaw surgery, top jaw, bottom jaw, and the chin, that would take longer before. Now you do it on the computer. You have surgical guides with um, cutting guides and then custom plates. So it's pretty quick and pretty straightforward with small incisions, and that's a big trend also.
Minimally invasive, custom treatment.
Custom treatment for that specific patient based on the 3D scan we got before.
So
And
you're using CBCT for that?
yeah, for orthognathic surgery, we use our CBCT in office CBCT.
Gotcha. Are you doing orthognathics in your office? You go to the hospital?
Good question. So this is more a hospital case. For example, if it's just a chin surgery, you can do it in the office. Um, but anything more than a chin, um, I I'd rather be in the hospital with the patient fully intubated, and in general, we keep them for observation, 23 hours observation.
Gotcha. Those are
Yeah.
pretty transformational cases. We need to get some orthognathic cases going together. That would be fun.
Yeah. Yeah. But with you, every time I send you a surgical case, you turn it
Oh, nice.
into
Yeah, the tats.
into TADS, which I tell the patient I'm glad, he's saving you surgery, saving you healing time, and this is minimally invasive. And that's the other thing. That's it's a new trend. I feel like we can do a lot with TADS now.
Yeah.
So, what do you think about that?
I like the tats for certain cases, especially those open bite cases. They're very predictable. The posterior intrusion with TADS is very predictable, and it's definitely less invasive compared to,
For sure.
an impaction surgery with orthognathics. Things like class 3, those are jaw surgery cases. I find that around here I don't see too many severe class
Hmm.
3 patients, but those are ones that, everyone get it like one or two a year, and those are fun to do for sure.
Yes, yes. I feel like, it's based on ethnicity class three. You see them more south in Miami, or I trained in Chicago where there is a lot of uh, Latinos, Latinas there. So it's a lot of class threes there as well, and
Yeah, for
African
sure.
Americans. Here in Spring Hill or Hernando, Crystal River, I think it's mainly Caucasian. So I don't think there is a lot
Yeah.
of class
A
three
lot of
going on.
class 2 deep overbites.
Yes,
Yeah.
yes, 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 yes.
Yeah, for sure. So do you find that patients now are more educated in regards to some of the treatments that you're doing? Do they come in with more questions, knowing more information?
Yeah, I mean, definitely. And I would say it's good and bad. Good in a sense where they ask good questions, and I know when I'm talking to them, I know they understand what I'm saying, they understand the pros, the cons, the possible complications. And it's bad because sometimes they come in freaked out because let's say they read on ChatGPT something that just does not apply to their clinical case.
Yeah.
And I said that before again, I tell them, listen, this is not a complication that I would expect happening to you. I want you to come to the procedure, to the surgery in a positive mind. Don't think about it. It's not going to happen. If you think about it, more likely it's going to happen. Not that I believe in whatever bigger power. I just think that it's proven too. If you come in positive, your surgery, your recovery, your treatment overall is going to be great. If you come in trying to look for complications, you're more likely to have complications.
Yeah, I remember you saying that at that meeting, and that was my takeaway from your talk the most. And it's so true that the patients that come in with a positive attitude are the ones that get the best outcomes, and then the ones that are looking for a problem are going to find one.
Yeah, they're going to find one. I tell them, listen, if there is a problem, you will know, I will know, and we will fix it. Don't look for one if there is none for, you know.
So, what are some of the biggest misconceptions that patients have about some of your most common procedures? What would you want patients to know that they come in asking you, and the thoughts that they have are just not in line with actual clinical practice?
Yeah, I would say, a lot of about, wisdom teeth. People think, oh, I'm not having any pain with my wisdom teeth. I don't see them. I don't need them removed. And I tell them, you know, sometimes that's true. You don't need your wisdom teeth removed, but most of the time, just from a pure evolution standpoint, our jaws don't have as much room as they had 1,500 years ago. So you have to come in for an evaluation, and you do this very well. As soon as they're done, you send them for an evaluation. That doesn't mean I'm going to pull their wisdom teeth, but at least get an early evaluation, because again, the sooner, let's say, they need to be removed, the sooner they are removed, the easier their recovery is. If you're 56 years old trying to remove a wisdom tooth that finally start poking out, the recovery is going to be way harder than if it at 15, 16, 18 years old.
Yeah, so wisdom teeth is a big thing that I see in the office. That's my protocol. When they finish treatment, it's usually around that time we take an X-ray. What do you tell patients about wisdom teeth in terms of like what's the best time to get them out, the age to get them out?
Very, very good question. So, I tell them everybody's different, but in general, less than 25 years old, um, above 12, 13 years old, between that 12, 13 to less than 25, this would be the ideal time because the roots are not all the way developed, but they're developed kind of like around half. So makes it the easiest timing to remove the teeth. If it's easy to remove, therefore your recovery is going to be easier. Now, working here in Spring Hill, Hernando County, we see a lot of older people, right?
Right.
And this is why I know how important it is to remove them sooner, because you don't want to be 80 years old, 15 medication, blood thinners, and your wisdom tooth that has been in your jawbone for so long now starts to have external resorption or internal resorption, and you have an infection, and then I need to go in and remove it.
Yeah. Are there any times at a younger age with those patients that you do not recommend getting them out? What I see is they don't become fully erupted. I tell patients they're not functional teeth, even if they're in all the way. The only thing they could possibly do is cause a problem. And if it were me, I would advise getting them out. But I found that gets me into trouble, so I just say go get an evaluation now and let them take a look. Let Dr. Rezki can let you know what he thinks. But from what you see from young patients, and then when you see older patients, are there any situations where you find that you would leave the wisdom teeth be and you wouldn't think it would be healthiest to have them removed?
If they come in young enough, less than 25 years old, and their wisdom teeth are impacted, 80-90% chance they'll be removed because the surgery is very straightforward, and that just avoids you having cysts, tumors, or issues in the future. You're going to recover for 3-4 days now, and then you're done for life. Of course, I give them the option of, hey, you might be good without any issues, or you can have an issue. And there's like, they always ask this question, how likely do you think I'm going to have an issue? I'm like, only God knows. I don't know. But if it was me, because they're impacted, meaning in your jawbone, they're never going to come out properly. Leaving it in there is always only can give you either a cyst, tumor, damage to other teeth, perio pockets, and then I don't want you to be 80 years old and needing them removed at 80, or especially with the growing population now.
Right. I mean, I see patients that come in adulthood for orthodontics, and the ones that have their wisdom teeth, I find overall they have a less healthy looking mouth, more
Mouth, yeah,
difficult, occlusions to correct. And if they had just gone, and then right, it's more challenging and high risk of complication once they're older.
older. Yeah, once they're older and erupted, there is a misconception of thinking that impacted wisdom teeth are harder than erupted wisdom teeth, but it's actually the opposite. When they're still impacted on a younger patient, it's way easier to remove than when they're fully grown on a 30, 40 years old patient.
Gotcha. I'm sure you do a lot of wisdom teeth during the day. What's your favorite procedure to do clinically?
I like pretty much everything, from implants to wisdom teeth to, I do also facial trauma. I'm on call at our local trauma center. So I do that in general on weekends or after hours,
Mhm.
after the clinic. But one of the other life-changing thing that I would say I enjoy doing is the, same day teeth procedure, where
Oh yeah.
basically you have somebody, struggled all his life. Or I had like a case on a younger patient. She was unfortunately a drug addict, and she wanted to turn her life away, about 40 years old, and all her teeth were all, met mouth. And same day teeth. She came in, of course, pre-op. We did the surgery on the computer with the prosthodontist, and then the day of the procedure, she came in 7 a.m. At 12, she had implants on top, implants on the bottom, teeth screwed in, new life. How about that?
Amazing.
Yeah.
Amazing. That's kind of the
Yeah.
signature treatment for you guys at Coastal Jaw, the same day teeth.
Yes, yes, I would say so. Yeah, yeah, yeah. And that, I would say this with orthognathic surgery on a very bad class 3, where you can see as soon as you're done in the operating room, you can see the bite and you can see his facial profile changed. That would be the top 2 favorite procedures, life changer procedures,
Yeah, transformational that, it's
for
pretty
sure.
cool. I see similar things in orthodontics when you just see the change that you make in someone's life. And even when, they don't necessarily know it at the time, you know that they're always going to be thinking about what you did for them and the change that you made
Absolutely.
for them. It's pretty cool.
And I see your social media videos on Instagram, and I'm like, wow, their faces, and I think you guys felt them when they see their faces without the braces for the first time.
Yeah.
And I remember myself when I got my braces removed, and I just remember looking in the mirror, and I'm like, is this me? Are these my teeth? And as you said, I would never forget my orthodontist.
Yeah, it's pretty cool stuff, and we get to work together a lot and really enjoyed our collaboration the last few years. Tell me a
For
little bit
sure.
about the importance of collaboration between orthodontists and oral surgeons.
Yeah, I think that's a very good point you bring up, because you want to have the key is the communication and the trust between both professionals, so to ultimately serve the patient the best way. When you send me a patient, I have to deliver, and your referrals are very clear. You tell me, call me, and sometimes I'm in the room in front of the patient with their parents in the room, and I'll call you in the room, so we So, and they see that, we communicate, we text, we we discuss the X-ray, and they're seeing that, and they're like, okay, this is a team. They're together for us, and I feel like it makes a big difference.
Yeah, the parents see it builds trust in both of us that they know that we're working together and we're all on the same page.
Absolutely,
What
absolutely.
about things that orthodontists can do to make your life difficult? What do you see from orthodontists that makes things challenging for you?
You guys are perfect. No problem at all.
I love it.
No, if I have to do, just simple stuff. I honestly, we're fortunate that you're great, and a couple other orthodontists in the area also. It's the referral thing is very important, especially if we need to pull teeth. If you circle a certain tooth, especially for ortho, let's say premolars, right? If you say, please remove first premolars, and then you circle the second premolars on the referral, and then
Yeah.
I'm calling the office, and the office is not being, and it's not you. You're perfect. You've never done this, but just communication on the referral, or something else also is, you want me to remove a tooth, but there is still a bracket on the tooth. I'm
Mhm.
not removing that tooth if there's a
Yeah.
bracket on the tooth. It's like, you
Yeah.
gotta remove the bracket, make sure. It's like, no, it's this one. No, you gotta remove the bracket. It's kind of like Swiss cheese model.
Yep, yep. And we use different language for teeth than outside of dentistry. So our upper right four is tooth number five. So
Yes,
I know
yes,
that there's
yes,
probably confusion that sometimes comes in with those. So I always write upper right first premolar,
yeah,
number
yeah.
five.
I trained in international system in
Okay.
Montreal, so I get that, no problem. Like 4 5 4 5, I get it.
Any common mistakes that you see in orthodontic cases? I'm sure you see a lot of patients that come in for wisdom teeth after braces that end up needing further treatment or needing surgery that, like just from
Yeah,
outside the lens of orthodontics that you see being done poorly, where patients need either orthognathic surgery or further orthodontics.
yeah. I would say, it's if I have a patient in front of me, I would say it's very important that you look at the credential of whoever is doing your orthodontia, because a lot of people, they don't know. All they see is straight teeth from here to here, straight teeth from here to here. The bite is completely messed up. Their chewing is not good. It's not stable. It's gonna relapse. The airway is not taking into consideration. The jaw position compared to the face is not taking into consideration. All they see is canine to canine, canine to canine, premolar to premolar lined up. And unfortunately, I'm here sitting looking at that patient that got kind of like screwed, but as a professional, I can, you know, bad mouth or talk about somebody else, but at the same time, that patient um, has the right to understand what's going on.
Right.
So, you know, I would say that the main thing would be really, really look at the credentials of your provider. Um, Experience counts also, and it's good for orthodontia, or it's good for us too. There is a lot of people that are doing surgery that are not supposed to do surgery, um, and there is a lot of people that are not surgeons that do surgery and they do it well, and I have no problems with that too. It's just look at the credentials, look at the reviews, and um, in general, have a consultation with the provider. In general, um, once you're face to face with somebody, I think you can sense if that person is an honest person and telling you the what you're gonna get.
Yeah, I mean, I see the same thing, going for surgery. I love working with you, and I send all my patients to you that need any type of surgery, whether it's an impaction, wisdom teeth, and sometimes we get patients that come back and say, "Oh, can you give me a referral for, this other place?" Like, well, I work with him on all these cases. This is who I trust, and then every once in a while I get someone back, and it's not what I was hoping for, and And then, like you said, you can't say something bad about, you know, the other practice, the other provider, and then you're kind of stuck, you know,
Yeah,
treating something that's not a great situation. And it's the same thing that you mentioned. You want to say something, but at the same time, you need to maintain that professionalism as well.
yeah, yeah,
So those are tough.
mhm, yeah.
In terms of the patients that are getting orthognathics, what do you want patients to know in terms of getting ready for that type of procedure?
Yeah, regarding jaw surgery, what I tell them is in general, if they see me first before they see you, before they see the orthodontist, I tell them I'm going to send you to my orthodontist. In general, I send them to you, and then I tell them uh, he's going to have a consultation with you. And basically, what he's going to do is going to make your bite worse. It's called decompensation. So your body try to compensate for the bad jaw alignments, but what we want is put back the teeth on the bone. So by putting back the teeth on the bone where they're supposed to be, it's going to make your bite worse for the next 6 months to a year. Once your teeth are in the bone, then you come to me, we plan your surgery, then we put back the bones where they're supposed to be, and then you go back to Dr. Strouse so he can line up or do the final touch up.
Yeah, and in regards to that, so once you have that patient for surgery, how important is the orthodontics that comes before the surgery in terms of making things easy and predictable for the actual surgery?
Yeah, I mean, as you know, the good decompensation with good occlusal plans, it's key. It's just gonna make my life easier and ultimately surgery easier, recovery faster, more predictable results. And again, communication is key. If I need a certain type of surgical hooks or the patient is ready to go and surgical hooks are not there, and then I have to use extra screws to put him into IMF and stuff like that. So communication is key in any case.
Yeah, for sure. What's the typical downtime recovery for those jaw surgery cases now?
I would say I tell my patient you're not gonna like me for the first week.
Okay,
After that, kind of like every day starts to feel better and better and better. Um, at about 4 weeks, you're almost back to normal, and I send them back to you at 4 to 6 weeks
that's awesome. So a lot easier than, people
back in
think.
the
People
days.
imagine it being a much bigger thing that's going to seriously impact their life for a long time.
No, absolutely. And again, it's case dependent, but for the most part, this is exactly what I tell them. You're not going to like me for the first week, not so much the pain because you're actually numb. So you're not feeling much pain. It's just mainly sinus, nose being clogged, and then a lot of swelling. After the first week, you just survive the first week, then life starts getting better and better and better. You're back to normal after 4 weeks.
Yeah. So if anything that you would want patients to know about you, your practice, anything or places that they could find what you guys are doing.
Yeah, just coastal jaw surgery, same day teeth on Google. There's website comes up and you can see all the reviews we have. And the main thing is I think in our practice, our office, it's very important that we have, one leader and even above him, we all I think very not only cultured but also all believe in God and we know there is like a higher power. And I think this is very important where you're you always know that somebody is looking after you. So you do your best and then God does the rest. And I feel like he helps me cope with the everyday life and every day, when things don't go my way or don't go patient way, you know that there is always that greater power above you and helping you out.
Absolutely. Well, I appreciate you doing this. It was great to chat with you here and look forward to continue working together.
Absolutely, absolutely.
All
Thank you.
right. Very good. Talk soon.
Talk soon. Take care, my
All right.
friend.
Bye.
Bye bye.